Toxic drug deaths have gone up again in BC, according to the latest report from the BC Coroner, breaking what appeared to be a downward trend of death at the beginning of this year. The latest data says 165 people died from unregulated drugs in April, and most died from fentanyl. What's often not as discussed is the number of people who survive an overdose but suffer some kind of brain injury. Earlier this year, a report from the BC Centre for Disease Control says between 2020 and 2021, the number of people who became brain damaged because of drugs rose significantly compared to the period between 2015 and 2019.
The existence of these drugs in our community will directly continue to result in damage to the brain of people who use them.
In September last year, the province launched what it called secure care for people with long-term addiction, mental health challenges, and brain injuries from drug use. In 2019, a study found that over 3,000 people using drugs in Vancouver saw no significant improvement in their drug use habits when coursed into treatment compared to those who didn't get any treatment. But the province's chief advisor on psychiatry and toxic drugs clarifies that BC's version of involuntary care focuses on patients unable to make decisions.
Forcing them into care when they don't have a mental impairment associated with their mental disorder, that is highly controversial. That is, for example, what is being attempted in Alberta. What we're doing here in BC is clarifying that the Mental Health Act, which is the involuntary care of people who have a mental impairment that makes them unable to choose and exercise their liberty.
When someone has a brain injury, one of the things that can impact is memory and decision making. That doesn't mean you need to be involuntarily detained. It might mean you need systems navigation.
The director of the Canadian Drug Policy Coalition says people brain injured from drugs don't necessarily lack capacity to make decisions, and that the system could be more proactive to help them.
Why are we focusing on detaining people after a preventable injury rather than getting ahead of it through programs that would actually stop injuries from happening? Let's focus there.
While Dr. Vigo says BC is expanding both voluntary and involuntary care options, some mental health advocates suggest there's too much weight on the forced approach.
The conversation appears to be solely focused in many jurisdictions, not only British Columbia, on involuntary treatment and involuntary care.
The annual count of deaths from drugs dropped last year after nearly a decade of a public health emergency. And still, there's no indication that BC has turned a corner on its highest unnatural cause of death. In Vancouver, Kier Junos, City News.